Harare Central is one of the largest referral hospitals in Zimbabwe. Junior doctors have been on strike for 2 weeks to demand more money and better working conditions. Patients say they don't know when things will return to normal.
Some of us are in pain. If doctors don't help us, then our health will deteriorate. Please think about what we are going through.
Many state-run hospitals across the country are struggling financially. Junior doctors say it's frustrating working in them with a lack of equipment and drugs. Zimbabwe's doctors are some of the worst paid in Africa.
A junior doctor is earning $329 in a month.
And is that enough?
That's by far less than enough to get by, let alone to be able to attend this, to afford the particular services that we offer. I, as a junior doctor, am not able actually to pay for my medication to Parenya to a hospital or in Mpilo hospital in case I fall ill, let alone that of my family.
Health Minister David Parengatwa says he needs more than $1 billion to increase salaries and improve resources. But the government's broke and there's a shortage of foreign currency. Nurses and some senior doctors are trying to keep things going, looking after patients who are in some of the wards. The doctor strike is getting quite serious. It's now into its second week and some public facilities across the country don't even have access to essential drugs. The main opposition leader, Nelson CHAMISA, says Zimbabwe's health sector has deteriorated since President Mnangagwa took over from Robert Mugabe in November.
You can't come in and say you are open for business. Things are happening when they are not happening in the hospitals, when they are not happening for our patients, for our people. That is unacceptable. And Mr. Mnangagwa is accountable for every death that we have recorded.
Mnangagwa's biggest challenge is fixing Zimbabwe's economy, ruined by decades of corruption and mismanagement. Government ministers are talking to leaders of the striking doctors, trying to convince them to return to work. Overworked and underpaid nurses in public hospitals are also threatening to down tools. If that happens, the already dire situation could get much worse. Haru, Mutasa, Jazeera, Harare.